Right now, there are millions of Americans over 60 taking blood pressure medications every single morning, trusting that those pills are protecting them. And most of the time, they are. But there are 3 specific medications, prescribed millions of times every year, that have a hidden problem your doctor probably hasn't discussed with you. They are slowly, quietly damaging your kidneys. And what makes this so dangerous is that you feel absolutely nothing until it's serious. Kidney damage from blood pressure medications doesn't hurt. By the time most people find out there's a problem, they've already lost a significant portion of their kidney function permanently. I'm Dr. Sarah Mitchell, and if you want clear, research-backed health information built specifically for people over 60, subscribe so you don't miss what we're covering next. The 3 blood pressure medications with the strongest documented evidence for kidney damage in adults over 60 are diuretics, ACE inhibitors, and NSAIDs taken alongside them. Now, are NSAIDs blood pressure medications? No, they're not. But over 40% of seniors taking blood pressure pills also regularly take ibuprofen or naproxen for pain. This combination creates a dangerous chain reaction that kidney specialists call the triple whammy. A study published in the British Medical Journal found that combining an ACE inhibitor, a diuretic, and an NSAID doubled the risk of acute kidney injury. And if you're over 60, kidney function naturally declines roughly 1% per year after age 40, meaning these risks hit seniors harder than anyone else. Let's start with diuretics like hydrochlorothiazide and furosemide. They lower blood pressure by making your kidneys flush out extra sodium and water. They work, but here is the catch. Your kidneys need adequate water to do that job safely. Studies show that up to 40% of adults over 65 are chronically underhydrated. Combine that with a diuretic, and you're forcing your kidneys to work at full capacity without enough fluid. Over time, these filtering channels dehydrate, become stressed, and contribute to chronic kidney disease. Comment below and tell me, did your doctor ever talk to you about how much water you need to drink while taking this medication? Now let's talk about ACE inhibitors like lisinopril, enalapril, and ramipril. They work by relaxing blood vessels and are usually safe. However, they become highly dangerous if you have undiagnosed renal artery stenosis, a narrowing of the arteries supplying blood to your kidneys. This condition is common in older adults and causes 0 symptoms. Your kidneys depend on internal blood pressure to filter waste properly. ACE inhibitors reduce that pressure throughout the body. In kidneys fed by narrowed arteries, reducing that pressure is like trying to push water through a kinked hose. Almost nothing gets through, causing a massive drop in kidney function within the first 6 months of treatment. The most reliable screening tool for this is a non-invasive kidney ultrasound with Doppler imaging.
How do you catch this silent damage? Only through blood tests. Specifically, you need a creatinine test and an eGFR checked at least once a year. A critical safety note: never stop your blood pressure medication on your own. Uncontrolled high blood pressure damages kidneys faster than any drug. The goal is simply to treat it smarter. Here is your quick step-by-step action plan. Ask your doctor, I'd like to check my creatinine and GFR to make sure my medication isn't stressing my kidneys. Switch your painkillers. Replace daily ibuprofen or naproxen with safer alternatives like acetaminophen, Tylenol, or topical pain gels. Hydrate religiously. If you are on a diuretic, drinking 6 to 8 glasses of water daily is protective and non-negotiable. Share your full list. Bring a complete list of all prescriptions, supplements, and over-the-counter pills to every single appointment.